All right, so we're diving deep today into something I think we all know a little too well, right?
Yeah.
Throat infections.
hmm
We've got a whole bunch of research here, medical journals, even some like old school home remedy stuff.
Oh, cool.
Should be interesting.
Yeah.
So, we all reach for the cough drops when our throats are scratchy.
Yeah.
But what's the real deal? Like, what's actually happening in there, and what can we actually do about it?
Well, you'd be surprised, even though it feels like such a common thing, there's a lot of nuance to it.
Yeah, okay.
Like what causes it and then how you should treat it and even how to prevent it.
Okay, so let's break it down then. Like, first off, the causes.
Yeah.
We've all felt it, that scratchy, sore throat.
Right. Yeah.
But, like, at the root of it, what's going on?
So it could be a few things. It could be a virus or bacteria or even a fungus.
Oh, real? Fungus?
Yeah. Yeah. And each one needs a different approach.
Mm.
So it really matters that you know what you're actually dealing with before you start treating it.
Yeah, makes sense. It's like you wouldn't think something so, like, normal as a sore throat would
Yeah.
have so many different
Right.
reasons behind it. So how can you even tell? Like, how do you know what you're dealing with?
Well, lots of times it's viruses like the common cold
Yeah.
or the flu. And then there's strep throat, which, lots of people have had. That's bacteria. But, and this is interesting, sometimes the Epstein-Barr virus, what causes mono,
Yeah.
that can look like a regular throat infection at first.
Well, wow. I've, like, totally forgot about mono. I haven't heard about that in ages.
Yeah.
But our sources also mention things like smoking and pollution.
Yeah.
That's kind of surprising. So, like, it's more than just infections.
Totally, yeah. It's not always these little bugs,
Yeah.
like your environment has a huge impact. So smoke, pollutants, allergens,
Right.
anything that can irritate your throat and make it inflamed. Oh, and this is something I think a lot of people have probably experienced, like acid reflux,
Yeah.
GERD. When stomach acid comes back up.
That can really mess things up and feel a lot like an infection.
Oh, wow.
Even just talking a lot can irritate it.
Yeah, that's true. I feel that sometimes. Okay, so before we all lose our voices completely,
Right.
let's talk about preventing this. Besides just like, basic hygiene, is there anything we can actually do to like avoid getting these things in the first place?
The biggest thing is it's surprisingly simple.
Okay.
Staying hydrated
Oh, right.
and eating healthy. Like, so many people forget about that. But you want to keep those mucous membranes moist. And your immune system needs to be strong. A humidifier can also be really helpful, especially if you live somewhere dry.
Yeah, okay, good tips. Now, for the not so fun part,
Right.
what actually works when you already feel that scratchy throat coming on?
So this is where knowing what's causing it really matters.
Okay.
If it's bacterial, like strep throat, usually antibiotics are the way to go.
Yeah.
But antibiotics, they only work on bacteria,
Right.
not viruses.
Right.
And we're using way too many antibiotics these days.
It's a big problem. So you got to see a doctor to get the right diagnosis and only take them when you really need to.
Absolutely. No self-medicating. So for viral infections, then, what can you do?
Rest is super important.
Yeah.
And just taking care of yourself.
Okay.
Over-the-counter painkillers can help with the discomfort. And here's a tip that's been around forever. Honey.
Oh, yeah.
Seriously, it's so soothing. It's been used for centuries. A warm herbal tea with some honey can really do wonders.
Okay. That's a remedy I can get behind. So you've given me lots to think about, like figuring out what I have and how to treat it.
Right.
But what about recovery? Like, how long does this usually take?
That really depends on what's causing it.
Okay.
Viral infections, they usually clear up in like 5 to 7 days.
Yeah.
Bacterial infections, if you're on antibiotics, they take about 7 to 10 days. Fungal infections can be a bit more stubborn. Sometimes they hang around for like 3 weeks.
Oh, wow.
But no matter what it is, rest is super important.
Yeah.
Give your body the energy it needs to fight it off. And that includes your voice. No
okay.
shouting or long phone calls until you're better.
Good point. Especially for someone like me who likes to talk.
Right.
Speaking of things we like, let's talk about food.
Okay.
When your throat's on fire, what should you eat or avoid?
So it's all about being gentle and nourishing. Warm broth is great. Soft fruits like bananas and yogurt, because of the probiotics, can help too.
Okay.
You want to avoid anything spicy or acidic.
Right.
And crunchy snacks, those can irritate your throat. And of course, stay hydrated. Lots of water.
I know what I'm having for dinner tonight. But before we all go grab our chicken soup,
Yeah.
got to talk about the red flags. Like, when does a simple sore throat mean you need to see a doctor?
Right. So most throat infections, they're mild.
Yeah.
And they go away on their own or with basic treatment. But there are some warning signs. If you have a high fever that lasts more than 2 days, difficulty swallowing or breathing, symptoms that don't go away even with treatment,
Oh, wow.
any rashes or joint pain, you should see a doctor.
Okay, that's really good to know. I feel a lot more prepared to deal with sore throats now.
Good.
It makes me wonder, though, if all this talk about pollution,
Mm-hmm.
could there be a connection between, like, rising pollution levels globally
Yeah.
and more people getting throat infections? Something to think about.
Interesting.
Anyway, stay curious, everyone. Stay healthy.
Yes?
And thanks for joining us for this deep dive.
Thanks.